Hello everyone, you are all welcome to lecture number 1289 and still in continuation of prostate cancer topic, its causes, symptoms and treatment, and this is your part 3. Part 1, part 2, I have already discussed and given you very clear picture of cancer and its management and global marketing of cancer. Now I will be focusing on prostate cancer and I will conclude. But here, one of my observation I want to share with you. My aim of delivering this lecture and sharing my scientific medicinal chemistry experience in a very simple language, so that common man, 90% people in remote area like Gwaza Hill, Bama, or even Biu, the whole Nigeria or India is reaching. Of course, more than 100,000 people they are watching. More than 2,000 people every day they are waiting. But still, when I checked and I found that 90% people who are watching, they are not touching, only it needs touch, your attitude, positive thinking, to touch, like and subscribe. So that if it comes, I will be happy to know that at least it is reaching to millions. My target is let it reach to millions of the people. Where in India we have 1.45 billion human beings. In Nigeria we have 220 million population. So at least this lecture, I can say charity of knowledge of cancer and science and so many different type of health condition is reaching to millions. This is my target. It's charity. I'm not getting anything from anybody. But at least I expect human feeling that once you are watching and you are getting from somebody, at least you have that much courtesy, that much human feeling. Human feeling is very important to at least trust to subscribe, and at least in that comment you can say, oh, nice, good. Only that thing, it requires only 1 second. So it will encourage me. So please change your attitude in the life towards positive. If you are gaining from somebody, at least appreciate. So now come to this prostate cancer. I have already told you that prostate is just like walnut size or akhrout size, and it is very important. It is playing the role of releasing fluid, and in that fluid the male's sperm is swimming and flowing to the egg of the female for the fertilization. It's a very important part. But once it gets inflammation or chronic inflammation, there will be damage of this prostate gland cells. And once cells are damaged, that damaged cell may become tumor in the form of either malignant or non-malignant. Malignant means cancer cells. They become cancer cells. And once they become cancer cells, I call them idiot cells. They will not be following any discipline and they will go on multiplying. And it will create a pressure. And that pressure will be on your ureter, where urinary bladder is there and where your urine is collected. And that urinary bladder will be under pressure. And you will feel always the sensation of urination, especially during night. Several times you will be going. And also you will be having urinary symptoms. Urinary symptoms means once you are releasing your urine, you will feel pain, and while you are going to stop, then you will pain, and always there will be tension and pain around pelvic area. You will be always feeling weak and tired, fatigue. Sometimes you will get fever, and your all the normal activities will be disturbed. So in that condition, it will be very difficult to perform your normal activities. So the first thing, what are the causes? First cause is that is genetic factor. Genetic means those who are having family history of getting prostate cancer, there is maximum chance. And genetic factor means their genetic material, that is DNA, deoxyribose nucleic acid, where the gene will be changed. So in that DNA material, sequencing of the DNA material is changed. That is called genetic change and genetic mutation. Mutation means change. And that change may be positive and negative. If it is positive, it's evolution. That's why we human beings are evolving. And if it is negative, it will become cancer or malignant cell. So first is genetic mutation. The second is, that is your lifestyle. Sedentary life, poor diet. You are not getting balanced diet, which includes antioxidant or anti-inflammatory compounds. Then environmental factor, I have already told you that if you are living in a polluted area where there is lot of pollution, lot of dust particle, lot of heavy metals, lot of other pollutants are there in the air, and where there is deficiency of oxygen. So all these factors, that is environmental. So I'm going to show you one by one, but first I will show you the images of prostate cancer. You can see here in image, it is below the urinary bladder, and that very small gland, that is prostate gland, and this is the one which is responsible for releasing the fluid. And if there is some damaged cell means, or it is cancerous, we call it prostate cancer. And once it is enlarged because of inflammation, then there will be pressure on urinary bladder, and your urinary system will be disturbed, and you will be always feeling the sensation of urination and always pressure. You can see here in black size very clear picture of two lobes of prostate gland, left and right, and in between there is a dark black color spot. That spot is nothing but the tumor of the prostate cancer, and that is your cancerous cells, and it is developing, that is the bunch of cells in the form of tumor, and that is malignant for your prostate gland, and you are suffering from prostate cancer. This is the image of your enlarged, where inflammation is there of your prostate, and in the beginning the malignant or cancer cells started multiplying, and you can spot them here and there. That is the beginning condition, primary stage, and at this stage, once it is diagnosed, there is a maximum chance of survival for long time if you take care of your lifestyle. So here I have given the summary of what I have discussed, and I have discussed a lot about the cancer in general. So this summary is focused on the latest technologies and of course new type of drugs, immunotherapy, and also how the T cells are manufactured in lab and it is injected in the form of vaccine. All these new therapies are going on in 2024. So number one, a cancer in a man's prostate, a small walnut sized gland that produces seminal fluid. I am not going to discuss much because I have already given all this in my lecture. Fluid, and that helps to transport the sperms. Sperms for the fertilization of eggs. Number two, causes of prostate cancer. Number one, it is genetic factor, and that is gene mutation. I have already given explanation. That is family history and genetic mutations such as BRCA1 and BRCA2 can increase the risk of prostate cancer if such type of gene expression is there. And number 2, that is age factor. You are at high risk after the age of 60, 50 years age. Number 3, diet and lifestyle. That I have already mentioned that you have to include in your diet anti-inflammatory, antioxidant, fruit and vegetables, and you have to go for alkaline food, that is 80% fruit and vegetables. Reduce the processed meat, dairy product, sugar, acidic foods, and saturated fat. Number 4, environmental factors. Exposure to toxic chemicals and heavy metals like pesticide and insecticide and some other pollutants which are radioactive in nature. Then number 3, symptoms of prostate cancer, that is urinary symptoms in general. So first is urinary symptoms like weak urination, also interrupted flow of urine, irritation, frequent urination especially in the night, and painful burning sensation, that is during the flow of urine. Number 2, pain in pelvis area, and once pain starts in your pelvic area and back, it means it is advanced stage of prostate cancer. And in most of the cases, prostate cancer, once it is reaching to advanced stage, only people come to know. Otherwise, once they are going for some, I can say, other test, only then it is discovered that they are suffering from prostate, either inflammation or cancer. Then, number 3, treatment of prostate cancer is a multi-billion infrastructure. Number 1, it is called digital rectum test examination, that is DRE, means where the consultant oncologist and they will insert with globes the rectum, their finger or some other devices, so that they will check the size and inflammation of the prostate gland. And number 2, prostate specific antigen test, and that test means prostate gland, it used to produce very specific type of protein that is called PSA protein, and that percentage, if it is high, it means you are having prostate cancer. And number 3, ultrasound, that is very common to understand and to know and to see the damaged tissue of or cell of the prostate gland. Then biopsy. And number 5 is active surveillance. Active surveillance means you have to be very careful of your lifestyle, of your diet, of your medication, of your environment. That is called active surveillance. You have to be very active mentally and physically. And number 6, radiation therapy. Now radiation therapy is very advanced. It's not that only any radioactive isotope is bombarded to cancer cells and which is killing equally normal and cancer cells. No, now it is targeted radiotherapy and very specific. That is precision medicine is there. And in the year 2024, in John Hopkins and in Harvard, that is in USA, they are very successful in targeted radioisotope therapy and very precise, that is called precision medicine, where 90% cancer cells are targeted, they are killed by radioisotopes, that is radiotherapy. Then very advanced one, that is called LUPSMA 617, that is called radioligand therapy. It's a very advanced therapy, and here this isotope, that is lutetium LU 170, that is used, and this one, that is PSMA radioactive material is bombarded, and by that very targeted upper cell of the cancer cell is damaged, and in this way it is destroyed. That is called LUPSMA 617 radioligand therapy. Then numbers 7, number 8, that is called immune cell therapy. Is a very very latest one, and here it is called CAR T cell therapy, where the human T cells, means immune cells, they are isolated, extracted from human body, and in the lab it is again treated and synthesized, and then after that synthesis, it is activated in such a way that once it is injected, it will work as a vaccine and it will attack your cancer cells, and that is called immune cell therapy, CAR-T cell therapy. So with this I will stop. Thank you very much for watching the lecture, and I wish you all, especially who cannot afford very very costly cancer treatment, then they should follow the management of cancer, that is by changing lifestyle, diet and bad habits. Once again, thank you very much for watching the lecture.